Hey guys, what's going on? Welcome to another video on my channel Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipelines. Visit my website at hairliciously.com to purchase your microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT Bucking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. So in today's video, I wanted to talk about a post that I saw on Trestless regarding a guy who ended up spending $10,000 USD for a hair transplant in the US. And apparently, it turned out to be a disaster, at least according to the poster. $10,000 is right around the norm for the price of a typical hair transplant in the US, especially for someone who's, kind of like in the lower 3 range. I think most clinics in the US charge anywhere from like $3 to $5. And typically most hair transplants fall between 1,500 to 2,000 grafts for this price range, at least for the first procedure. When I got mine in South Korea at Motion Clinic, I believe I paid around like 5,500 USD for about 1,700 grafts via FUE. The second procedure was a little bit more pricey since I got a little bit more grafts. I think it was like 1,800. And I also opted for the non-shaving method, which doesn't require you to shave your head. And for the most part, getting a procedure done outside in the US will oftentimes be more affordable since the cost of living is cheaper, which means a lower cost for labor. So he provided us with some pretty detailed before and after photos, and in his before photos here, we can clearly see someone with a diffuse pattern hair loss, very poor density in the hairline and mid-scalp. And, to be honest, diffuse thinners are difficult cases since they require a lot of the hair grafts to be placed throughout the scalp, in the front area, the mid-scalp, the vertex. And we can see that this guy is also thinning in the crown area. I don't really know his age at this point, but he doesn't seem to be that old. And cases like this will usually require at least, 2 sessions due to the magnitude of the hair loss region. And then this is a photo of him immediately after his procedure. This is a side profile of the temple and the hairline. Obviously a lot of redness. We can also see some of the grafts that were implanted on the temporal point region. And to be honest, it's not looking like the cleanest hair transplant that I've seen. Definitely a lot of area to cover. I would assume he probably got anywhere from like 2,500 grafts. It's hard to tell, but the density also doesn't look that great. Some of the grafts, if you guys take a look, weren't really properly trimmed. And some kind of look like they're even protruding out a little bit, which would put it at risk of either popping out or cobblestoning. I've seen a lot of post, hair transplant results where everything was very clean and the grafts were tucked in very nicely and the slits created, but this definitely is not one of them. But then again, we have to kind of wait and give the benefit of doubt and, wait for that full 1-year mark to really assess the overall outcome of the procedure. This photo here is 24 hours after surgery. We can once again see, a pretty vast area of coverage that was required, and the density also isn't looking too dense. I would assume that this guy probably wasn't on any hair loss treatments on the first onset of hair loss, given his extent of miniaturization, and likely just sought out a hair transplant simply to add in density to his thinning and balding areas. Here's another side shot. And once again, we can see that the density is just really lacking. And just from the looks of it, I feel like this guy is not going to be too happy with the outcome of his surgery. If I were him, I wouldn't be happy at all. Now, this is 6 months post-op, which is more than enough time to start seeing some decent growth. And we can still see very poor density, even at 6 months. He almost looks about the same, or even worse off compared to his before surgery photos. There's still visible bald patches on his scalp. His hairline, which is beefed up with hair grafts, doesn't even look like anything's changed after surgery. And more concerning is the general lack of density on the mid-scalp. Now, here's another aerial view at 14 months post-op. And it looks like he has actually lost more ground than what he initially started off with. And then finally, this last photo here is 15 months post-op, and we can still see that there is no, visible improvement to hair growth or hair density. Now, typically after hair transplant, you'll shed most of the grafts within like the first month and a half, and then you're going to start to slowly see some of the growth around the 3 to 4 month mark. This is when the implanted grafts are going to start sprouting out, and over the next, 4, 5, 6, 7, 8, 12 months, it's going to get thicker and improve in density. In my case, I think by month 6, I saw a lot of density and hair growth for both of my hair transplants. And by like month 9, I think I was approaching like 90% of growth. So, there's a couple things that could have gone wrong for this guy. The grafts that were implanted didn't survive, obviously, potentially due to a high transection rate, or maybe they just weren't stored properly after extraction, or this guy wasn't on any hair loss medication before and after his hair transplant. Or perhaps he was on hair loss medication, but they weren't sufficient enough to stabilize his hair loss. And as a result, he continued to lose ground despite having a hair transplant, which, could have also accelerated shock loss in some of kind of like the native areas. And this can also, speed up the miniaturization process and simply couldn't grow back as a result. So let's go ahead and dive deeper, because I really am curious to see what exactly happened and look at some of the comments to see if we can kind of get some more background context on this guy's case. Alright, so this guy here, you should see your doctor. Your grafts are popping after surgery. The density isn't even good. Whoever surgically trimmed the grafts did a horrible job, as this is most likely the reason for such bad growth. That and your doctor's surgical skills removing them. Put the doctor's name on there. Let's see here. Were you on finasteride to finasteride before or after the transplant? Honestly, I think just minoxidil, microneedling would restore a lot of your hair. That is true to some extent. Some people are hyper responders, but you're not really targeting the root cause of hair loss, which are due to the androgens. So in the long run, it's actually going to be detrimental because you're not blocking any of the DHT that is the main cause for hair loss. So where did you go get your transplant? Scottsdale, Arizona. Name is Shelly Friedman. So I think I've heard of this doctor a few times on some of the hair loss forums, but I'm not gonna give my opinion on this doctor in this video simply because I don't know him too well. So moving on. I'm not sure why you would go into surgery like this without taking finasteride. So it sounds like he did not take finasteride. So maybe he wasn't taking any 5-AR inhibitors or any anti-androgens, but he just decided to get a hair transplant simply because he was balding and he felt that getting a hair transplant would have solved his problems, but that was a big mistake because you always want to stabilize hair loss. You don't want to just go in and get a hair transplant and then in hopes of stabilizing after. You always want to make sure that before you get a hair transplant, you want to start on hair loss medication like finasteride or dutasteride, anti-androgens, and then you have other secondary treatments like minoxidil, microneedling, laser therapy. Because if you don't, you're going to end up having to always play a game of just catching up, and you're just limiting the size of your donor area. You're just using it up, and eventually it's going to deplete, and you have hair loss that is still progressing, but then you're not going to have any hairs in the back of your scalp to reinforce with density. So it's going to be a big problem. Let's see here. 6 months post-operation is the same as 1 day before. Literally none of the hairs are there. I agree. He's lost a lot of the grafts that were implanted, potentially due to shock loss, as well as a lot of the native hairs because he wasn't taking any hair loss medications to slow down the progression of miniaturization. Let's see here. Don't feel bad. Dude paid an equivalent half a Honda Civic. Blah blah blah. Get on the finasteride, minoxidil, microneedling, get free surgery in 2 years. In the meantime, sue the doctor. That might not be a bad idea. Get on hair loss medication and hopefully you're able to stop the damage that's been happening. So this guy's saying you are not a hair transplant candidate, just like every diffuse thinner. Even the best in the world would reject you even if you are on medication. So this guy is saying that diffuse thinners should avoid hair transplants and use medication. Diffuse thinners can still be good hair transplant candidates, but only once they've stabilized hair loss. If you don't stabilize it, like I said, and end up proceeding with hair transplant, you'll be playing an endless game of catching up as you'll continue to miniaturize. This also applies to anyone in general who is losing hair. The first thing, like I said, is to stabilize your hair loss with medication, and then once you've done so, you can consider getting a hair transplant to bring back some of the density in the problematic areas. Donor hair did not look to be of sufficient density or diameter to expect a decent outcome. Extract properly. Yeah, this is true. 2800 isn't enough for a thinner. You'll need a repair. Look up a doctor who also does body and beard graft and let it fill up correctly. So this guy's most likely going to have to go back for at least 1 or 2 procedures, assuming that he starts hair loss medication, is able to stabilize it, and potentially even see some additional growth. So I read here somewhere that he actually received about 2,800 grafts via FUT. And like I said, he states that he is not taking finasteride. So this guy was literally a diffuse thinner. He did not take any hair loss medication to stabilize from further hair loss. And he still proceeded in getting a hair transplant with nearly 3,000 grams. So that explains everything and why he was actually just so unhappy with his result. I don't think that it was a failed hair transplant, but rather the OP's fault for not fixing the underlying cause of his hair loss, which was due to the androgens. And then I read somewhere earlier that he was just using minoxidil and microneedling and laser therapy. And like I said, those are not going to be treating the androgens, which are the root cause of hair loss, DHT. And it's unfortunate that he said that he experienced side effects. I don't know if I probably read it here somewhere, but I can't find it. But he said that he had, some side effects from taking finasteride. But then again, he could have tried, microdosing topical finasteride, which I've covered in a recent video, and it's shown to have similar effects of DHT inhibition with less systemic absorption. He could have also tried adjusting his, oral finasteride dose to 0.5 milligrams, or even something lower to 0.25 milligrams. Look into other anti-androgens. I feel like the doctor should also be partially responsible, because an ethical doctor would never let a client go through a hair transplant, especially if they have not stabilized their hair loss, let alone not taking any hair loss medication. The doctor clearly knew what the outcome would be, but instead he still proceeded with a hair transplant, all because he was basically greedy and money hungry. A good doctor, a good ethical doctor would have opposed him in getting a hair transplant, would have given other options to stabilize his hair loss first with medication and then reassess in a year. But what this doctor did was, in my opinion, just very unethical, and he should definitely be held responsible to some degree. So at the end of the day, the lesson learned here is that you need to get on hair loss medication if you're losing a good amount of hair before considering getting a hair transplant. There are a lot of options available, like 5-AR inhibitors, anti-androgens, which would be your primary arsenal. Don't just get a hair transplant if you don't plan on stabilizing your hair loss, because you're going to end up wasting money, and eventually you are going to deplete a lot of your limited donor area while losing more hair. Talk to different doctors. Just don't get the opinions of just one doctor. Talk to different doctors and have different opinions on what they say, because not one is going to be the same as the other. Talk to other people who've actually had hair transplants. Do your own research. Read through hair loss forums, look at before and after photos. Another great thing that you guys can do is a one-on-one consultation with me. And we can go over different types of hair loss treatment options, go over reputable and ethical hair transplant doctors based on my research and experience, or also answer any questions that you have pertaining to hair loss. Don't do what this guy did and basically get scammed by this doctor. You can only get so many hair transplants, and it's important that you do it right the first time. But anyway, hope you guys enjoyed this video. Let me know your thoughts in the comment section below. Make sure to give this video a thumbs up. Thanks for watching, guys, and I'll talk to you guys in my next video. Take care.